to the Tracy Donegan podcast. In today's episode, I'm sharing a recent webinar on the fascinating topic of red light therapy and pregnancy, specifically pain in pregnancy and postpartum too. So if you're pregnant or maybe you've just had a baby, you probably have questions. In pregnancy, you might be wondering, is red light therapy safe during pregnancy? What does the evidence say? Can it help with back pain, swelling, or pelvic discomfort? Will it support recovery after a cesarean or a vaginal birth? These are the exact questions I hear every day. And in this webinar, we're going to dive into the science and some real-life experiences. You'll learn how red light therapy, also known as photobiomodulation, supports your body on a cellular level, helping reduce pain and accelerate healing without medication. And yes, we'll talk about safety, what we know, what the research says, and how to use red light therapy wisely during this important time in your life. I'll also recommend products that I personally use and recommend to my clients. So whether you're brand new to red light or already using it and just want to learn more, you've come to the right place. So let's get started. I am Tracy Donegan and I'm going to talk to you a little bit about really something that I think is flying under the radar for so many, for I think anyone that's dealing with health issues or wants to optimize their health and or is dealing with pain, especially during pregnancy. It's red light therapy has kind of come onto the scene the last kind of couple of years, but there is a fear around using it around pregnancy. So I want to talk a little bit about that, what the body of research looks like at the moment and how we can really practically use these tools. I think it's one of the most exciting areas of medicine right now and absolutely in midwifery, but we just need a huge amount of education for birth professionals, for moms and their partners as well, so that we can optimize the use and just forget about the woo, because I was also thinking that when I heard about this first that it's new age, or somebody mentioned to me that about light medicine, and then what was the other? Oh, energy medicine. And as you will know me, I like evidence, and really robust evidence. We're not talking about a case study or two here, but actually really methodologically sound research that's coming out from around the world. Actually, Brazil, I think at the moment, is publishing the most studies in this area. So I hope you'll enjoy it today, and please, we'll have some time at the end for questions. So a quick run through what we're going to talk about a little bit on introduction, disclosures and disclaimers. We're going to talk about the FDA here in the US. A little bit about the background, understanding what red light therapy, or also known as photobiomodulation or PBM, what is it? Parts of our cells that are really drinking up this light are our mitochondria. We're going to look at mitochondria in pregnancy and the huge maternal energy needs that we need during pregnancy. And of course, postpartum then for recovery. Then we're going to look at some of the benefits of PBM during pregnancy. Also using it for postpartum healing, which is absolutely fantastic, for looking a little bit about device safety and recommendations and Q&A. So I have to just start off today with really being mindful of the FDA. And if you look at, go on Amazon, you're going to see all of these red light products. Be very mindful about the products you buy on Amazon. First of all, I'll say that. But the FDA is very concerned about practitioners, or really anyone out there who's in this work, making claims that it will cure something, or especially when there may not be a huge amount of evidence around it in the US. But as I mentioned, we're seeing I think we're between 6,000 and 8,000 published studies on this area already. And a lot of them are really well-run, randomized, controlled, double-blind studies, and we're seeing it in various demographics. So the FDA, when we look at the FDA materials, they're defining photobiomodulation as the application of light at an irradiance that doesn't induce heating So we're not looking for something that's cause heating, because heating is a completely different mechanism for us. So it is going to alter biological activity, but not through thermal means. So this is not like putting a heat pack on. It's not like putting a heat pack on your back. You can get infrared like bands and things that are actually heating as well, and that's great for circulation, great for muscular pain. But it works on a very different mechanism if we're using heat as the primary mechanism. So it's the main aspect of red light therapy is it supports cellular energy. So this is what we can say about it. And then it's kind of up to, you know, consumers and birth professionals and to start connecting the dots from that huge body of research. So what we can say is red light therapy supports cellular energy and overall well-being during pregnancy or outside of pregnancy. One of the biggest things it does, as well as a side effect of that cellular energy, is healthy circulation. So when we have healthy circulation, we have the lymphatics working really well. If we have a wound or an injury, we've got the lymphatics working well to bring in all the healing properties, get those prostaglandins going. And inflammation itself, it's not a problem, but we just want to, what we're doing with the red light is we're accelerating that inflammation process. We're not interrupting it the way medication does. So healthy circulation, and for any of you who've ever had, an injury, or if we're thinking kind of postpartum and you've got, vulval swelling or swelling around a cesarean wound, when we relieve that swelling, usually we're relieving quite a lot of the pain as well. So that healthy circulation, I think if you kind of like add that, again, connecting all the dots, and then we have relaxation just as another part of it without the use of medication. And today, again, I'm not intending to diagnose, treat, cure, or prevent any medical condition as we move along. So, couple of disclosures. First of all, this was me at the PBM 2024 last August in London, and it was a phenomenal conference. It was a 4-day long, and it wasn't your average conference where you go to a 1-hour session on whatever that topic was you're interested in. It was like 4 days non-stop, like back-to-back academics presenting their research. So there were different tracks based on what you're interested in. There was a fertility one, which I went to, which was great, and to see the research where that's emerging from fertility studies. But some of the sessions that I went to on like the use of blue light for making, helping microbes be less resistant to antibiotics, because that's a huge problem that we have at the moment, is antibiotic resistance. So it was kind of like 30-minute sessions, and then we'd have the next presenter and the next presenter. So it was just research based. And for anyone who knows me, I just like to geek out on research. And so I was just in PBM red light heaven for 4 days. This was me wearing the SunPower LED. It's a transcranial helmet. So SunPower they had some really interesting videos to show where they're using it for things like traumatic brain injury. They had a video of a teenage boy that had an accident, big bump to the head, and was having problems with memory. And he used the SunPower transcranial helmet, and it had like a significant impact on his brain injury. Now, at the moment we're looking at, there's lots of studies around Alzheimer's and Parkinson's as well. So when it comes to products, I only recommend products that I have personally used, tested, or they have been vetted with clinical insights with other professionals or from the research itself. And I have recently opened a women's health clinic in Central Texas. So I offer PBM and also laser therapy, because LEDs are great, and it's great that we have access to them. Laser penetrates the tissues in a very different manner. So when I'm working with fertility clients or someone who's had like chronic pain that they haven't been able to help with a simple kind of LED system, usually with the laser, I can help them in a couple of sessions, and it really is magic. when you see how quickly it works. Again, this webinar is only for educational purposes. I'm not here to diagnose or treat anything. And do talk to your care provider about, you know, starting red light therapy. But what you might find, or you're most likely to find, is especially in the birth world, most obstetricians and midwives do not know much about red light therapy or how to really help their clients optimize using this for pain during pregnancy. So it's just so ridiculous to me that we have a situation where, you know, these are just US numbers, where we're looking at like up to 72% of women are experiencing pain in pregnancy that is affecting their quality of life. I think those numbers break down into like significant, like back pain is a huge one, and pelvic pain, pelvic girdle pain is another one as well. You also have, again, because of pregnancy hormones, we've got, you know, carpal tunnel. We have postpartum, the shoulder pain, if we're not, you know, lying back and using laid back positions. Again, it's very, very common. So what are we kind of told? You know, what we're told that, you know, pregnant women, oh, get yourself a heat pack, or do a little bit of yoga, some stretching, which can all be helpful. But really, women want an option that does not include medication, because we know that every medication is going to impact our pregnancy or baby in some way. It might be, you know, very insignificant, but I think overall, most women just don't want to take medication in pregnancy if they can avoid it. So what we're looking at here is what can we offer women that is not going to have that's not medication, first of all, that they can use alongside their yoga and their stretching and getting more sleep, because that's usually kind of what we're telling people as well. Get more sleep and get more rest. But when you're working full time and you might have a little one at home and you're pregnant, it's really not easy. And the Tylenol or the ibuprofen can sometimes, it feels like that's the only thing that I have available to me that's going to be effective. But we know there's also trade-offs with medication. So what is photobiomodulation or red light therapy? So it's a non-invasive therapy that uses non-ionizing. So non-ionizing means it's not changing the cellular structure itself. It is non-carcinogenic. This is not UV light either, and it's non-thermal. Now, sometimes with some devices, especially if they don't have a cooling system or don't have a way to turn it down, some of these products, especially cheaper products that we get on Amazon, and I have several, they get too hot. And we don't want to be, again, it's not having the same impact if it's a hot light compared to stimulating these cellular processes for inflammation and pain inhibition. So these are just a couple of images. These are actually from the Thor. These are Thor Laser in the UK, the UK company, and they use these multi-cluster LED systems for so many different issues that we have to deal with, and our pets have to deal with. And like PBM has been used on horses for forever. It's only now we're looking at, okay, so if it's having such a great effect on horses, you know, maybe we want to start adapting that to humans. And it's only here in kind of, you know, the US and Western Europe where we're so behind. The Russians have been using PBM or low-level laser therapy for like 50 years. They have a mountain of research. It's in Russian, but for anyone who's interested, Dr. Moscovin, and I'll share details at the end, has been doing this for forever, and he's always happy to take questions, using very low dose, and they use it for everything. And we've also seen it used really well found accidentally for fertility in Japan. So Dr. Oshiro was using low-level laser, but photobiomodulation for women who were experiencing chronic back pain. So what he found was he was treating some women who were postmenopausal, and what he had women coming back to him saying, I don't know if this is normal, but my periods have started again. So this was a completely accidental finding that, okay, this light, even low level light, is having an impact on reproductive health and women's cycles. So then he went away and did some really fascinating studies on red light therapy and fertility. I'm actually going to do another session like this on red light therapy for fertility next month, and I'll post those details out to everybody. So it's like we're going from NASA. NASA have already done studies on LEDs and wound healing, you know, within space, you know, because and think of like the NASA astronauts are, you know, they're not getting full sunlight. They're under artificial lighting the entire time. And it was so interesting to see the two astronauts that got stuck up in space last year, and how like being in that, you know, that weightlessness is one issue in itself, but being under artificial light for that length of time. NASA had mentioned, I think in a study, you know, probably 10 or 15 years ago, about how some of, you know, astronauts were coming back almost pre-diabetic because they weren't getting the full spectrum sunlight. They were getting artificial light, which is, no, I'm sitting in front of one here today. It doesn't have the full spectrum sunlight, so we're not getting the full benefit. But when we look at the research that is happening around the world, it is significant, and it is growing at such an amazing pace. And these are just the most of these are UK and European. But again, as I said, we're seeing like significant amounts of research come out of Brazil in this area. And I think in the NHS, which is UK, I think almost all of their hospitals, or most of their hospitals, now have PBM as the standard of care for oral mucositis. And it has just been approved here in the US for oral mucositis as well, which is a very painful condition that is associated with radiation and chemo. It's more pronounced in people who would have head and neck cancers, but it just means that they end up with these really horrific, painful mouth ulcers, and it can affect like their whole digestive system. So if you can imagine, if you're going through cancer and you can't eat, the impact that will have then, or if the pain gets so bad, you know, patients are stopping the treatment, which of course then affects, you know, whether they're going to get better or not. So I think, and next year the US is going to start covering, at least for oral mucositis, red light therapy will be the standard of care. So, and insurance will pay for it. So it's that's great to see. So let's look at what's approved and experimental use. So actually, I'm just going to kind of move on to the next one. So I just want to show you this picture. So this was I think like a 3-year-old in St. Jude's Hospital, and they use it's like a lollipop they're putting in their mouth. So it's safe enough that the child can use it themselves. So this is the oral mucositis treatment. So what they'll do is they'll put it on the outside of the cheeks, and they'll put it inside. And then, so we're getting lots of these beautiful wavelengths in the mouth, into those, and it's very easy to penetrate because it's the oral mucosa. So when we're looking at where is the strong evidence? The strong evidence at the moment is musculoskeletal pain. And of course, that's what most of the pregnant women are dealing with. Oral mucositis, of course, we are... this is, again, great news for, you know, around the world, and I'm hoping that more countries will adopt this as the standard of care. Strength and recovery after physical strain, and then dry AMD, which is a eye problem. And then there's moderate evidence then around lymphedema. So for women who might have had breast cancer surgery and are dealing with, again, like swelling in their arms, and the swelling that often leads to pinched nerves, so swelling and pain. And then, of course, wound healing, which we're seeing, it is... I didn't include some of the more graphic images that I have seen around wound healing, but I'm very happy to share them, because anyone I can get to talk to about PBM, I'm sitting there, I have my phone, I'm like, let me show you these pictures, because really a picture just speaks 1,000 words, and telling somebody how well this works and looking at an injury at, 2 days post-surgery and looking at it, 3 days later and then 3 weeks later, it is like night and day. So it is, yeah, I will, as we say in Ireland, I'll talk the hind legs off a donkey if someone will give me an opportunity to talk about red light. So when we look at the more experimental studies, then there's research happening around stroke, mood, depression, PTSD, all the way down to like opioid addiction. Fibromyalgia, there's lots of really nice studies coming out around fibromyalgia and full body PBM. So you might have seen some like the panels, or these, they look like the old-fashioned sunbeds from years ago, when that we probably shouldn't have been using, but we're using to get a base tan before we went on our holidays. So just quickly, electromagnetic energy is, so when we look at the energy waves that are around us during, any particular day, it goes from, we've got, gamma rays, X-rays, more dangerous, coming into ultraviolet. And then you can see right in the middle here, we have what's considered visible light. And below you'll see what's the visible spectrum. So it goes from like at the kind of borderline of UV, then up into red light. And you'll see there's different wavelengths, different numbers associated with those different wavelengths. And it depends on how energetic they are. So like blue is a really high energy wavelength that we don't need deep penetration for. So it is great for wound healing. And as you'll see in a minute as well, we're already using it for jaundice. And then we move out into the infrared, and infrared penetrates much more deeply into the body. So for musculoskeletal, we need the kind of the 800s and up are our best options. So again, this is not new. We have been, cultures around the world have been, honoring sun gods, and it's been part of culture and religion for many, many years. And you've probably come across this in your life, not in your work, around blue light. So how did we get to the point where we knew to put babies under blue light? Well, we had a nurse in the UK who was taking babies outside who were jaundiced to see if it would help with their jaundice. And I think it's just something that we just, and you probably can relate to this more, like you're always being taught, look, get out and get outside, get some fresh air and some sunlight. And that's kind of the cure for everything that ails you, getting outside. So this nurse was taking babies out into the sun, and they were noticing that the jaundice was getting better. So then we move on, a few years, and now we're looking at, okay, so we're already using light therapy in maternity services. So we put these babies under these blue lights. We don't have to have very deep penetration, but it's high energy. So while, especially preterm babies, their liver capacity might not be enough to help them break down that bilirubin, the lights will do it for us. And so we don't need the liver functioning. What happens is the blue light turns that bilirubin into lumirubin, and the baby then pees it out. So you're already seeing red light and blue light. We call it red light therapy or photobiomodulation, but blue is also included in that. So this is fascinating. Like, we spend about 93% of our time indoors under artificial light. That's 93% of the time. But we know that we evolved to be outdoors, and our body really loves full spectrum light. When we're indoors all day, we're under artificial light, which, as I mentioned, has lots of blue, which is high energy. It's great for during the day when you want to be focused. But we are paying a price for sitting in front of screens that don't have filters, or under LEDs, or under, the normal light bulbs in our homes are LEDs. We're not getting full spectrum unless you go and really kind of go look for full spectrum light bulbs to have in your house. And we know that using these like artificial lighting, especially in the evening time, sitting in front of our phone, we are slowing down and dampening our melatonin response. And melatonin is a huge part of labor. We already know that the lighting affects. We used to talk about, for doulas, when we're going into the hospital with a woman, that sometimes her labor will slow down, and we always kind of put that down to anxiety or the stress of kind of moving location. But when we look at the environment we're bringing women into, like fluorescent lights, and most doulas will, as soon as we get in the door, it's like turn off all the lights. That's the first thing we do, because melatonin and oxytocin work really well together. So red light therapy itself, it's a very narrow band of light, but it is useful in ways for targeting kind of pain and wound healing. But the sun is the OG. We need to be getting out and getting more sunlight. And there was a fascinating study that was published out of Scotland, I think it was 2021. And they kind of did a review of, I think it was like 500,000 births in Scotland. Now, for anyone who has been to Scotland, it is a beautiful, beautiful country, beautiful people, but it's very Irish when it comes to the weather. So I wanted to kind of find a nice picture of Scotland that also showed an average day in Scotland with this kind of weather. So like Ireland, not seeing a lot of sunlight, but what they found was women who had more sun exposure in their first trimester tended to have less preterm births. And they looked at other, confounders like, smoking and other things that could kind of, change those or affect those numbers. But what was consistent was the more time women were spending outdoors in the first trimester, the less likely they were to have a preterm birth. So we've got to recognize that sunlight is a crucial part of pregnancy health. But the sun has been demonized for so long, but it is starting to change. So the different wavelengths matter, and this is just kind of looking at what we're seeing for anyone who has like a red light mask out there. I know they were big over the holidays for gifts. So we're looking at like violet and blue can be a disinfectant, and we know it is blue, especially force 15 wavelengths and around that, is now we're seeing in research it is having an impact on candida, so women who have chronic yeast infections. And the University of Tennessee at the moment is studying the use of blue light and strep. So when I heard that last year, I was like, oh, this is where I get really excited. So because at the moment, and it depends on which country you're in, whether there's routine, universal screening for group B strep or not. Some women are, if they have their test for group B strep, especially here in the US, it's just assumed that you're going to have antibiotics in labor because it's transient and we don't know. And it's only a small, tiny percentage of babies that will be impacted by this. But we're weighing up, especially if you're, a first-time mom, you're trying to weigh up, well, do I take the antibiotics and know that this is going to have a significant impact on my baby's microbiome and my own microbiome, and kind of what is the long-term impact? Or is there an option maybe to start using a new therapy that hasn't been developed yet? We don't know exactly what the dosage or the specific wavelength is, but I think we're going to see some really exciting stuff coming out of the University of Tennessee as an option for women to use blue light, especially if they can get some of that rapid GBS testing at their hospital, and then maybe using blue light in labor. And then we've got green is associated with, for pigmentation issues, but there's new research on green light being really helpful for migraines. So again, another way for women who are sensitive to migraines in pregnancy, this is a great option as well. So I really like this image because it kind of explains a little bit more about how it actually works. So if you think of these are the Russian Matryoshka dolls, It's working at such a cellular level. This is why it has such a profound impact on all of the systems of the body. Because I think, like a lot of people, when I heard about red light therapy first, it just sounded too good to be true, because like it's helping with, oral mucositis. It was helping women with, deal with, lubrication in menopause. It's now they're looking at using it for Alzheimer's and sore muscles. Like, I think we've all kind of, grown up with the idea of, yeah, if something sounds too good to be true, it probably is. But this is one area that we can say that because we are working at such a cellular level, these are the tiny mitochondria that are in all of our cells, or most of our cells, and we're just helping them work better. And when they work better, then our cells perform better, and then the organs and the tissues perform better, and then it's having this beautiful knock-on effect of wellness then in our women. So what's really important, though, we have to have the right wavelength. So if you have, if you got a little backache during your pregnancy, blue light's not going to help you. Green light's not going to help that backache. So we have to have the right wavelength. The right wavelength, think of a wavelength as a color. We have to have the right power. Is it powerful enough to actually penetrate into, deep tissues in the back? Or is it reaching the ovaries or reaching the uterus? Can we use this in labor? Is it something that we can use as pain management in labor? So we're talking about where are we placing the light as well, and then the right time and how long we're using it for. So I think what we're going to see as, again, more research emerges, and I think as the credibility then is established with the medical profession, we're going to see more of red light therapy being a prescription. Because it's like if you have a problem, you go to your doctor, they give you a specific prescription based on what you're dealing with. At the moment, it's kind of very fluid, and because there's a lack of education, it's like, oh, just throw a bit of light on it, and it's like, okay. But for specific health issues, we want to prescribe, and now we're seeing that there is, the research that it is becoming dose dependent. So we're looking at the right dose and the right power and the right wavelength, getting it to the right part of the body. So these are these beautiful little mitochondria. I love these because they are, you might have learned about them in school. These are the little batteries. We call them the powerhouse of the cell, but they're also a processor in our cells as well. And they're sensitive to what's going on in the body. So they're like little cell phones, and they have to be charged. Like plants, they get, they need sunlight. So if we're not getting outdoors, and I always say, make being outdoors, that's the priority, and then use your light therapy, your red light then as for specific issues. But these little powerhouses, what they're doing, it's with the light, they, absorb the light, and it has a whole cellular, I won't go through Krebs cycle and cytochrome deoxidase and all the technical stuff, because it's fascinating, but it's a lot to take in when we're just kind of, going to focus on pregnancy. But these little guys are like little batteries, and through age, inflammation, our lifestyles, they're not getting as much light as they need. And specifically, they're not getting near infrared if we are not outdoors. So again, being outdoors or using near infrared lights, whether it's a band or a wrap or a panel, it really charges up those mitochondria so they can go off and do what they're supposed to do. But this is the kind of the main theory of how red light therapy works. But if, depending on, there's other theories around, and it gets really complicated, fascinating but complicated, into quantum physics and how we make electrons jump into higher orbits and how we excite the electrons. And when I hear this, I was like, yeah, this is getting too complicated for me. I just want to stick to midwifery and helping women use the light. But it can do two things. So when we activate and stimulate the mitochondria, it has this, it's a stimulatory effect to the body. So we're getting just the nice right amount of light in, so it will go and help modulate inflammation. It will increase that lovely circulation around the body and the lymphatics, but it can also be inhibitory. So what we see when we look at these mitochondria, like under the microscope, when they are exposed to higher levels of light, a higher level of light then, and sometimes it depends on how our body actually responds to the light, but the higher energy, then it stops the mitochondria sending signals out to the cells, and it looks like it has what they call a kind of a rosary bead. You get these little kind of blocks that come up in the cells. So it stops the mitochondria, it stops the cells transmitting that information. So I use red light kind of pad with women in labor. It's so they are well informed and like to use it, and it really has a significant impact on, especially with moms who want to avoid medication on the day. So if you think of pregnancy, it's almost like we are running a marathon every day during pregnancy. So we have this huge demand on energy during our pregnancy. So like if you think of like a normal person who is running a marathon, they're just running a marathon, and they have to, they're going to make sure they're really fit and they've had something to eat and their battery is fully powered as they're going into that marathon. Whereas we're running that marathon in pregnancy, we're running that marathon literally every day when it comes to that energy expenditure, because we've got a placenta we're growing, we have a uterus we're growing, and a baby and breasts, and all of these changes, even like the increase in our blood flow. So what the red light is doing, it is like charging those little batteries internally at a time when we have a huge energy demand on our body. So how does it work as an analgesic? So again, as I mentioned earlier, it starts off, we want to start with that blood circulation. We get the blood moving. So that stimulates then the immune response, and it helps cells talk to each other. So what we don't want to have is, we want to modulate the immune response, because inflammation itself and the immune response, the inflammation is helpful. Inflammation brings all of the great cells in to gobble up all that bacteria and help the cell and help the wound start to heal, or whatever that muscle injury start to heal. So we don't want to shut it down. We just want to modulate it, make sure it's the appropriate response, which is what the light does, and not inhibit that inflammation response. Because there is some research that when we interrupt the inflammation response, I think this has been seen in people with chronic back pain, that when we start, if we automatically reach for the ibuprofen, we're interrupting, especially in the acute injury stage, we're interrupting that inflammatory response. It is more likely to turn into a chronic back condition, because we've interrupted the inflammatory response, which I thought, when I heard that, I was like, okay, so you have an acute, you twisted your back funny, what are we supposed to do? Well, light, let's get the light on it, and maybe some heat for circulation as well. So there are things that we can do in that acute phase so that we don't end up having chronic backache as a couple of years down the line. It releases natural painkillers, or endorphins. And then, as I mentioned, it blocks the transmission of those pain signals quite quickly. It's not wellness fluff. As I mentioned, we're talking 6,000 studies. It's not about glowing skin. It does make your skin look nice, which is great. I'm not interested in face masks, so I'm not going to talk about it today. But for modulating the inflammatory response and pain management, it can be incredibly helpful in pregnancy. So how am I using it at the moment? So, and again, I'm going to refer back to the FDA, and I'm going to say it may do this. This is kind of what I'm seeing with the women that I'm working with. And I work with women, not just locally here in Texas, but because women will contact me kind of from all over the world asking about this and how they can optimize their red light devices. So there is some nice studies on carpal tunnel syndrome, which again, if we're reducing inflammation in those nerves, then and any swelling, then any edema, we get rid of that nerve compression, and again, stimulating that healing response. Pelvic girdle pain, this is absolutely magic for anyone who is, and this is a condition that, like, if anyone's watching this and you have it, I am so sorry, because I know how it can impact your quality of life. And I've seen women on crutches and really, like, just really not getting to enjoy their pregnancy because they have this SPD. Vulvar varicosities. So I was working with a woman recently who is a hairstylist. So she's on her feet all the time. And this was a huge issue for her. And of course, it's varicosity, like that swelling, that edema is really common after labor as well. So very simple way of getting that edema moving, getting that blood flow moving, reduces that vascular pain. And we're also seeing now in the research, with a recent paper comparing red light therapy and the padsicles, and what the ice is doing. The ice is causing vasoconstriction, so we're not getting all those goodies into the area, and we're not getting rid of the stuff we don't want. So but she had like this really, she uses it regularly, and she also used like compression garments as well, but has really helped her be able to work longer, because as anyone watching here based in the US, maternity, women don't get a lot of maternity leave here in the US. So she knows, she's self-employed, she will be back to work quite quickly, but now she has some tools to help her kind of to stay comfortable. Muscle tension then, things for lower back, legs, hips, shoulder tightness, from postural changes during pregnancy, especially that lower back. So postpartum, cesarean incision pain. There's some lovely studies and they're all cited at the end of the presentation. I'm happy to share the slides as well. Again, increases the circulation and reduces inflammation. And there's some really nice pictures in some of these studies where you can see using the light, as soon as possible after the surgery. And actually, more recently, now they're suggesting that we are using the light therapy as prehab, not just rehab after surgery. So anyone who's we're not talking about pregnancy here, outside of that, anyone who's planning on having surgery, that we're doing prehab, we're getting the lymphatics, all of that circulation going before they have their surgery. We're priming the body for repair, and then getting the light on it as soon as they are out of, as soon as we can get to them and get the light on. Perineal healing, increases circulation, again, more effective than padsicles. Nipple trauma. There's a couple of midwives in Ireland that are using for nipple pain. I use it myself. There's a great midwife in Australia that also she runs training on this as well. Again, so simple. We can use a little bit of blue light that will help mitigate any microbes, nasty microbes we do not want around that area, especially if there's any fissures or wounds already there. Relieves soreness, again, gets everything flowing, and then back pain and the postpartum, just general. We talk a lot about postpartum depletion, and it's like this is and make sure you're eating right and someone's looking after you. And like, okay, if we can help throw some light in here as well and help those women recharge those batteries that are going to be at a lower level simply because they've just been through a huge event that has like metabolically been quite intense for them. This is quite interesting as well for breastfeeding. So for women, a lot of women who are breastfeeding, especially if they're breastfeeding, you're into, maybe you're coming up on your first year or second year, that will complain of, especially because of the lack of estrogen, that they find intimacy, sexual intercourse quite painful because of the lack of lubrication. This is such a great way to, again, non-hormonal way of supporting our breastfeeding journey, and also, supporting, our relationship with our partner as well, by using red light. And there is some lovely research looking at using red light therapy for anyone, for menopausal women, and whether that's menopausal natural menopause or women who've had menopause induced because of cancer treatments. So again, it's like we're seeing we have options, more options for women. So again, we have to look at the different devices. When we're choosing a device, it's really going to be based on what our goal is. These are, so the product that you can see here, the wand, is something that I've been testing this myself, and I love the fact that it has blue and it also has red and near infrared without a heating element. This I think is kind of leading the way at the moment, and it was developed, designed, created by a group of women here in the US, with partners in Canada. So, and they're chiropractors and PTs, so they know a little bit, physical therapists, they know a little bit about women's bodies. So it's really a nice product. So, but again, this is not something we're going to be using in pregnancy. This is something for postpartum, and I'm talking postpartum. We can use the wand, or we can use the pad there on the right. We just cover it, and you can sit on it for oedema postpartum. The wand I wouldn't be using until we have, we're at our 6-week appointment, not internally anyway, but you can use it on the outer tissues. But as generally current wisdom suggests we do not put anything into the vagina until we're about 6 weeks, until the cervix is completely closed. So for deep tissue, for muscular soreness, you need skin contact. So you'll see that the image down at the bottom left, this is what most people associate when they think of red light therapy, because this is how it has evolved with the the influencers and the sports performance, that you're standing in front of a light. But just I can see with this woman here, so much of that light is bouncing off her body. So, and it's also dependent on how close you are. So I like the devices that are in contact with the skin or the oral mucosa, whether vaginally, because if we can, especially if we can even press it onto the skin, what we're doing is we're displacing blood, and we're getting that light in at a deeper level, so it penetrates deeper. So any distance between your light source and your skin, it's going to lose power. And the further away you are, and based on how powerful your device is, it's getting less and less as you move away from it. So what do we need to know about safety? First of all, it is considered safe to use in pregnancy, but we do not target the bump. So we don't apply red light to the bump. There isn't any research. I'm not sure if there ever will be research, but the most recent paper that is actually around the oral mucositis paper states that it is not a problem to use red light in pregnancy. Again, let's get outside first, but using red light then for pain is absolutely fine. We don't want to target light to the bump. Although the baby is expecting, as the bump grows and the skin on the bump gets thinner, the baby is expecting to have access to near infrared. So when you're outside, please go and put your bump out in the sunlight, just not 12 noon if you're living in Texas. So again, safe sun exposure, but without sunscreen and without sunglasses. Always follow the device guidelines and avoid overexposure, because sometimes we tend to think, well, if 10 minutes really helped my lower back, let's see what an hour can do. So, because what we find is if we overdose we end up, it's that Goldilocks effect. We're trying to get that nice, in the middle, so that it's called the Aaron Schultz law. We want to get that therapeutic window. So if we don't use enough, it won't have any impact. And that's one of the reasons why I think so many people have said, oh, I tried red light therapy, it didn't do anything. I want to know, well, what was the device? What was the wavelength? What were your goals? And sometimes it's because, and not all Amazons on our products on Amazon are junk, but you take your chances. And sometimes they say, oh, I bought this and it hasn't been third-party tested. So I would say I would usually want more information when somebody says it didn't work, because we have compelling evidence now that it really does. So too little it won't have an impact. And that's why people say it doesn't work. We get into that really nice therapeutic level, it's working great. And if we think, oh, well, a little worked really well, I'm going to go and do, 50 minutes with my red light, we just end up with no effect. So we're not seeing that it's damaging the cells. We're just back to it's not doing anything. The body is not responding to the light anymore because we've just overdone it. So the ideal session, again, starting off with 10 minutes. I would even start with 5 minutes, especially in pregnancy, just because our skin can be extra sensitive, and then work your way up into kind of a 20-minute session. You can do more if you are dealing with pain. So what I find is if someone has, again, lower back pain, using the wrap in the morning, and maybe they'll use it later in the afternoon or in the evening as well. We can definitely use it more as required. But if it's something that, again, as long as it's helping, we can use it frequently. So best tools that I think for moms, forget the big panel. So red and near infrared pads. I really like the Nova Lab pad because it's the highest irradiance that is available in a pad that's really comfortable to wear. And I do, when I have, as I'll share further on, I only recommend products that I personally have used or know people that have gotten really, really good results, or it's clinically, there is some research around it. But I do, when people purchase off my my page, an option for them is that I will design a protocol for them based on their health history. That's kind of nice part of being a midwife as well. Based on their health history, whether they're on medications, I create a kind of a personalized protocol for them, or whether it's for fertility, whatever they're dealing with. Because I would rather do that than again, it's only specific products. Because I had someone ask me the other day, why don't you recommend the big panels, and which are quite expensive. And as an affiliate, I could, probably earn quite a bit if I was an affiliate for some of the products that are out there. But I'm really conscious of the companies that I work with and the products that I have myself, and what's really going to help women, not how I can make a quick buck through an affiliate program. So the light pads, I think, are great for, like I recently just got one for my dad in Ireland who's having shoulder pain. So again, light pads that are in skin contact. I don't particularly like the wraps that have the plastic covering on them. I prefer the kind of the neoprene because they're really comfortable on the skin. And especially if you have a good product that's not, doesn't have a lot of heat coming out of it, which it shouldn't, and have different features that you can turn up the intensity, turn it down, set it for different periods, or just use the red, near infrared, or combine them both. Handheld lasers and torches for precision. So for nipple healing, again, if most of the pads don't come with blue. Again, because blue is really high energy. So if you're getting a torch, you want to get a torch that you can switch on blue and you can turn it off, and you can switch on near infrared, you can turn it off and switch on red, or combine, or sometimes you can combine all of them. But for nipples, perineal healing as well, the torch can be helpful. But I just like the pad because you can literally put some cling film on it, a saran wrap, and sit on it. What's a skip? Oversized panels. Again, if you don't have the skin contact, you're still going to get some systemic benefits, but not for targeted relief for like areas specific, like low back, perineal, or nipple pain. Or gimmicky gadgets that have like low power or no clinical backing, which is, unfortunately, there's quite a bit out there, kind of fly-by-night companies that are kind of, you bought your product and they're gone the next week. So pre-pregnancy, there's lots of studies now demonstrating the effectiveness of red light therapy. Preconception, again, like think of someone who is really intentional about, we're planning a pregnancy, we are taking our folic acid or our folate, we are looking after our health, we are priming our body because we want to be in the best health for pregnancy. That also means we want, as we're building that baby from like literally cellular, the sperm and the egg. We want a quality egg. And we know that there's a significant fertility crisis in the world right now. We want a really quality, lovely, juicy egg. And we also want really fast, healthy sperm. So there was a paper just came out this week on using red light therapy for sperm and how one wavelength can be really helpful for sperm. And there's another that will increase ATP, that cellular energy. And there's another wavelength that will actually stop that cellular energy. So there's so much education that we need to really understand. And it impacted the sperm for an hour, like immediately. This is an immediate impact. So pregnancy, I always suggest start around the second trimester, especially as you start to, get those musculoskeletal issues. Again, using on the wrists, lips, lower back, vulva, shoulders. And I have yet to come or find any health condition that using red light therapy in a way that is, the right wavelength and using it very intentionally. I've yet to come across any health issue, any health complaint that it has not been helpful for. And if for anyone who's watching this, if you've used red light and it hasn't been helping you, please get in touch, because I would love to hear again more about how you used it, what your goals were, and more about the features of the device that you were using. Postpartum, cesarean and perineal sites, we want to get the light on that area as soon as possible after birth. So for any postpartum doulas, if you're going to see your mom in, your clients, the moms in hospital, I know some do to get breastfeeding supported, make sure they have their belt or they're using their red light as soon as possible. Birth doulas, again, use it. We're going to use it for lower back during labor as well. Breasts for nipple relief, use it after nursing or pumping. Again, with the light, you can use it as often as possible, often as you need it. What the midwives in Ireland, where they're using it, it's so, we assume, if we have a, sore nipples, that, okay, of course we have to first fix, what's happening with the latch, what's happening with, the positioning. And when we fix all of that, then what we're looking at is, okay, how can we also support these moms? The light therapy, especially if they're using low-level laser, it takes seconds to get that relief. We're not waiting a week. So if you can imagine how that might impact breastfeeding rates around the world, if you have someone that is dealing with so much pain and they're distressed and they're just thinking, I just want to stop, and we can now give them an option to really help manage that pain so quickly, and only sometimes a few sessions, if even. I know some of the midwives in Ireland have said, they come in, they're with me for like literally 5 minutes, and part of that is me doing my documentation, and they're gone. I mightn't even see them again. So for some people, that one session is all they need. And then for other complications, if someone has other things going on, mastitis, and that, they may need, of course, more support. And then, of course, back pain, use it every day. This is my blog, and there's probably over 100 different areas that I've looked at. Most of them, you will see this, the research is being cited, or relevant research is being cited. It's not specifically around this particular issue. But you can find it at tracydonningham.org. And yeah, there's lots on pregnancy, postpartum, and quite a bit on fertility as well, because I just feel like that is such an underserved area as well. Do you have any questions? Or was that was kind of a whistle-stop tour of PBM, and I know there's probably another 2 hours of content that I could squeeze in. But do you have any questions, Anne or Beverly? Anything I can?
I mean, that was extremely interesting. And if somebody wanted to get and like how, presumably go to your blog and order it from there, is that correct?
Yeah, they can do that. Or if they want to reach out and let me know, because a lot of women have gone and bought these products already. And because what's interesting is where this came from, the whole red light therapy. These lights were originally grow lights.
Mhm.
And the Chinese manufacturers saw an opportunity in the wellness space. So all of a sudden, these grow lights turned out grow lights for special plants turned into grow lights for humans who need light as well, but we're just not getting it. But yeah, so someone will contact me and say, look, can you tell me how I use this device? Based on like, and they'll send me, you know, all the features, whatever, and all the specs, and then I can help them use that as well. I also do kind of like a 1 hour Zoom call, and I'll have, you know, the women themselves, they'll fill in quite a comprehensive, you know, kind of intake form. So again, I know what we're working with, and how to best help them. But I do the Zoom calls as well, and that's again mostly for women who are trying to figure out how to use it for fertility. Because with the light pads, it's you know it's working because you get the relief. So, but with fertility, because we're working with much deeper tissues, we're trying to figure out, okay, so we're trying to, you know, look at, you know, hormone profiles and making sure we're tracking all that so we can see that it is making a difference instead of just, it's kind of like it is the Wild West out there at the moment when it comes to these products. So really being discerning about what you buy, or buying something that you know somebody else is using and they've had really good results with. Really, you want to, most of us don't have a lot of money to waste on products that are just going to, you know, pack it in, you know, after 10 uses, you know. So, and our products get so much use here at home when I'm not, if I'm not in the office, if I'm in the office and I've got tweaked shoulder, I'll laser it in 5 minutes and it's great. But at home, we use, we don't just use it for ourselves. We've had the most incredible results using red light therapy on our dogs. So I'm like, why wouldn't we? Again, it's helping. I don't think there's anything it's not helping yet, and I'm maybe that'll happen at some point. But again, because we're working at cellular level and we're just getting those mitochondria to really be energized, have the energy to do what it needs to do, whether that is killing off cells that are not helping, it's modulating inflammation. It really is exciting. It's so exciting, and especially for women's health, because women's health just has for so long been ignored in the research, or we're thought of as, you know, like little mini men. So, but we have very different needs, and I think for fertility, pregnancy, and postpartum and menopause, yeah, it's such a simple tool to use, not complicated, and really makes a significant difference.
So what would it cost? You know, let's say somebody said, I'm going for a C-section. I'd like to buy this and have it when I come home, or for my vaginal area. What might they cost to be involved?
So if they're using, you know, a good wand or a torch or a pad, it's probably going to set you back about $300.
Okay.
No, I have to say now, as much as I love the wand, and I think for someone maybe who's dealing with, you know, chronic yeast infections or even BV, you know, if we have all of that going, I think the wand is worth the investment. For postpartum and kind of general pregnancy musculoskeletal, the pad is absolutely fantastic because you can use it for so many different things. Like, and I'm always finding new uses for mine. So last week I was at home with just a bad dose of a flu, and so I wasn't going into the clinic. So I was like, okay, I'm going to use my the Novolab pad. So it comes with things so I can strap it around my knee. So I was in kind of lying on the couch for a couple of days anyway. So I had it on my knee a couple of times. And then just last weekend, I get restless legs, and you know, and I do take magnesium, and I'm good on all my supplements, and foot cramps. So, and it was so, I always remember in pregnancy, it was just the worst thing. I will get the worst cramp in my foot, and my toes will just go like in all different directions, and it is so painful. And I have to hop out of the bed, and I'm kind of stretching it, and I thought, why am I using my light? So I got the wrap and I wrapped it around my foot because again, it's flexible, really nice and tight. And I kind of just did kind of, you know, 20 minutes, and the muscle was still contracting a little bit, But I was like, oh yeah, because it's increasing circulation and it was contracting, but there was no pain. So
Mhm.
for me, I was like, because usually I'll just sit there and I'm like, okay, I've tried walking it off and I'm just gonna have to let it do its thing and just breathe through it. But I thought, I'm like, why am I using the wrap? And it was, so I'm like, yeah, that's on my list now as well for foot cramps and
Mhm.
so yeah, so I would say expect to pay for a really quality pad, and you'll know it's quality because the company will have a really good returns policy. And like 60 days, if it's not working, send it back. So if a company has that kind of quality and they will do returns and they've had their products third party tested, then I think it's an investment, and I think the pads for general, for again, like for women in menopause, and I only heard this recently, and I didn't know anything about it. Again, because of the estrogen depletion, for somebody who maybe is not taking HRT, the frozen shoulder is associated with estrogen depletion. So I'm like, okay,
Mhm.
so again, here's another way to use it for women who have frozen shoulder, tennis elbow, hip pain. Um, yeah, so I love it. I just don't think there is anything out there at the moment that is safe, non-invasive, has no side effects that can do what red light therapy can do for women's health and the partners as well. But I want to work with women. Beverly, any questions?
Yes, I sure do. I'm a CLT. I'm over here in Tucson, Arizona, so I'm here in the States. And uh where I got my CLT, we're not allowed to use the word healing because of FDA. But just the day before, which was Thursday here in the States, got invited to a lunch meeting and I met a lady from Medicare here in the States, and she's very interested. And this is just phenomenal because right now my nephew is expecting his first child. They never thought they could have kids. She's having some complications. Some of the complications, um, have been relieved, but I used what I have and I couldn't this just changes. I mean, she's already experiencing swelling. She's just now coming into her last trimester, experiencing horrible headaches, and she just couldn't be amazed. And I didn't realize just from your presentation how much can we use because she goes, do you have a wand? Where can I get a wand? Because she may end up having a C-section. So this is great because she's really interested on this. And that would be really great to like go and find your blog, like Anne was saying, or where we can go and buy something because she's really interested. I have also heard that it really helps with episiotomies and tears. Is that true?
Absolutely. Yes. And that's one of the reasons that I was saying, yeah, we don't want to, we need to move away from the padsicles and the ice. So ice it does feel lovely and soothing, but we are shutting down that inflammatory process. So, and because, and when I was at the conference, midwifery conference last year, and I was talking to Hannah Dallin, who is an incredible midwife and researcher in Australia. And she actually she developed the protocol for applying the warm compress on the perineum. And she was asking me, she said, it's interesting, because she says years ago you used to come walk into the postnatal ward, she says, and there would be all of these red lights. All the women were using these red lights on their perineum. But I'm not sure if they were infrared or they might have just been heat lamps. But yeah, and we're only scratching the surface here, because when we see how, like, we know here in the US, metabolically we're so far from healthy. Like the pre-diabetic, diabetic, and like I haven't even mentioned the fact that like 670 nanometer can help manage blood glucose levels, reduces blood glucose after a blood glucose test by 25%. So again, like there's so many this is not FDA approved, but what we are seeing in other research is that people who are going for blood glucose tests in Europe, the more sunlight they were exposed to before the tests, the less likely they were to have high glucose levels. Glenn Jeffries in the UK has done some fantastic research. And also I'm not sure if it's been published yet, but he has done research, similar research on red light therapy for people with type 2 diabetes. And they're showing almost similar, significantly impacts that blood glucose because the mitochondria is taking on that glucose. So the mitochondria is processing the glucose. So, I mean, could it be helpful shining 670 for 15 minutes on a pregnant woman's back to help with her blood glucose? It's not going to do any harm, we know that. So between the blood glucose management, so metabolically, and then when we look at, and this is so early stage, but I'm already seeing connections here, preeclampsia. Any of these metabolic conditions, again, the increase in circulation, the increase in that, in the nitric oxide, which is increasing vasodilation in the body, in the brain. It's this is an area that I think we should all really pay close attention to, because it is going to change the way we look after women in pregnancy and postpartum without medication or as an adjunct to medication, and something that's really safe.
That's wonderful. I'm just like starting out with PBM and the CLT, and it just makes me feel good that you use the word healing, and me just starting to meet with people and they're like, well, what is this? I didn't even know this existed, and I'm tired of being on medications and I want other options. And there is a I believe it was a gentleman that had posted something in our local Facebook page, and he didn't want to take any medications to go see the dentist. And so this is really great. I do appreciate this a lot. Thank you.
Oh, and it's always lovely to meet another CLT, you know, it's because there's just not enough of us out here, and we need to be educating the public on what's available to them, because it is like for people who, again, like cannot take medication or don't want to take medication, or they have bad reactions to it for whatever, or they're allergic, or we have you know, a non-hormonal option for, you know, induced or natural induced menopause. So I think, again, we're only scratching the surface. There is so much more to come. I will say, and again, this is another aspect to kind of this industry. When you go to a lot of device manufacturers, I just have a big issue with this, that they are citing studies that were laser studies. So we go to a page and we'll see, oh, this device is going to really help with ABC, and this is what it's going to cost you. And then you go, you know, they're citing, oh, and here's 3 studies. And you look at, if you just read the abstract or you just read the title, it's like, oh, wow, this looks like it has worked in these big trials. And then you dig a little deeper, you know, the devil is in the details, and you see that, oh no, this was a class 4 laser or a 3B laser that they were using, which of course is completely different because it works differently in the tissues and penetrates deeper. But we're definitely seeing more research around the LEDs and the consumer devices. And yeah, we can't make claims that tools will heal. I'm a midwife. I want to help women heal whatever they have going on. And if that's a device, or that's getting out and getting more sunlight, again, no sunscreen, no sunglasses. Yeah, it's we have to have the courage to share this information as widely as possible.
Agreed. Totally. Yes, exactly. And then there's other clients or patients that the older they get, they don't want to be poked with needles. You know, that's what the handhelds come in, or the torches come in.
Yeah.
Yes, thank you. Thank you again.
You're very welcome. I will, if you'd like me to send you on the slides, I'm happy to do that. Yeah, but
That'd be great.
if you have any questions, you know where to find me. And I'm going to apologize ahead of time for this. I was adding in some new studies today, so I've included the studies, but it is not formatted the way academic studies should be. I am working on another paper at the moment, which is academic, and I'm like, I just hadn't got the brain bandwidth this morning. I was like, okay, if anyone needs help finding the studies, this should be fine. But if you I can get copies of studies as well if anyone wants to take a deep dive. And again, I think for people who are trying to conceive, especially older women who are running out of time and they've tried everything. It's like they're the women that I hear from. They're like, okay, we've tried everything. We've done the PRP. We've done all these other add-ons. What it's not working. What else can I try? So and I'm just delighted to talk to them. Take care, everybody. I will send you on the slides.
Thank you so much for tuning into today's episode. Remember, empowerment begins with knowledge. If you enjoyed our time together and want more content like this, don't forget to like, subscribe, and share with your friends. So stay inspired, stay informed, and until next time, take care of yourself.